for you to review. I'm not going to go through all the slides today because I want to save time for our demonstration. But there are important aspects of the back pain consultation. Okay? A big piece is really understanding the context of care, what the patient's psychosocial issues are, what are their determinants, what are their addictive possibilities, what are the issues maybe with using some active movement. Sometimes employment or disability is an issue. So typically we'll start with non-pharmacological therapies if we can, although a standard cocktail for back pain, acute back pain, is an anti-inflammatory, maybe a muscle relaxant, but a lot of times those can be modified or improved with non-pharmacological therapies. Teaching stress management and pain coping mechanisms can be helpful. And this is a major national problem. You see here, the Institute of Medicine had a big paper on how we can transform and relieve pain in America. And it comes down to tailoring the patient's treatment to somewhat of a self-management program and also customized to the individual patient. That's where it's helpful to have a maximum number of options. Complementary alternative medicine therapies are very frequently used. This is a little bit of an older slide, but I don't think things have changed much. Many of the kinds of problems people go for these alternative or complementary therapies are for pain: back pain, neck pain, joint pain, arthritis, migraines, etc. And we see an increasing risk of disability for musculoskeletal conditions over the number of years. And so this is makes it all the more imperative to be effective in our treatment of back and other kinds of musculoskeletal pain. So why should we use an integrative treatment? Well, the chronic pain is a moving target. There's more patients in chronic pain. There are more therapies available. Patients often are using these complementary therapies. I had two people ask for a massage and an acupuncture treatment as I rolled my little table up here today while I was in the UHC building. So some of these things, the patients have comorbidities. They do need some improved coping and management and strategies. They need to address cost of care. And a lot of times there's a synergy of therapies. One thing doesn't work, use a kind of a bouquet of options. So a standard sequence is just the patient comes in for their initial evaluation. They get the NSAIDs, muscle relaxants, home exercise, physical therapy. If that doesn't work, maybe then some imaging, orthopedic consultation, often more physical therapy after that. And on occasion, they will get more like surgery or epidural steroids. But then how about instead of just going down that road, considering from the beginning some mind-body techniques? How do you help the patient cope? Possibly some massage or chiropractic or some of the anti-inflammatory diet, botanicals, acupuncture, water therapy I find enormously helpful for these patients. So this is the kind of standard World Health Organization pharmacological approach to pain relief. And as you see, it starts with aspirin, acetaminophen, nonsteroidals, and works its way up to morphine. This is actually a big problem, as you probably have read in the paper. More and more patients addicted to hydrocodone, oxycodone, and so forth. And the DEA is really making it more and more difficult for patients to get these prescriptions filled on a regular basis, because there's actually more people killed from overdoses in the last couple of years than from car accidents. So it's going to become a major health problem in and of itself. So the American College of Physicians and Pain Specialists came up with a series of recommendations, which you'll have the slides for. I just want to highlight a few of the things. The focused history, physical exam, essential. Imaging, not right away, okay? They don't recommend routine imaging in non-specific low back pain. It doesn't alter the course of treatment, and it may actually confuse the situation, increases the cost of care. Medications can be useful, but they also recommend non-pharmacological therapies for acute back pain, as the ones we're talking about here, this interdisciplinary approach: exercise, acupuncture, yoga, cognitive behavioral therapy, muscle relaxation. This is a busy algorithm that kind of gives you the more detail by that same academy. And this is actually a nice synopsis of diagnostic work, of things you have to think about a little differently if the patient has cancer or suspicion of an infection or a compression fracture herniated disc. So if they're not on therapy, again, this is the algorithm. You can look it over when you have a chance, because it's in the slide set, because we're going to go into a little bit more detail. And then this is just an intervention matrix. So I use this kind of a menu plan, an appetizer. We mentioned history, checking the patient's expectations, ruling out depression, educating them. The antipasti, breath, mindfulness can always be helpful. It's cheap, inexpensive, helping patients relax better. Breath work and mindfulness doesn't take away pain, but it helps patients cope better with it and make them more of an observer of the pain. And then we can go on to other things like yoga, mindfulness-based stress reduction, biofeedback, Tai Chi, and then acupuncture, hypnosis, supplements. It's a very interesting article in a family medicine journal recently that says we're really over-treating back pain. Is it time to back off? And in the last few years, there's been a huge increase in expenditures for epidural steroids, opioids, lumbar MRIs, and even an increase in spinal fusion surgery rates. I do a lot of acupuncture in my practice, and at least 50% of the patients have already had spinal surgery in their back because their pain is not entirely relieved. So we kind of created this other kind of integrated pain relief ladder where we walk through these steps instead, or alongside the medication management. And the two are not exclusive. That's why I say often a synergy of things is helpful. If you go to Dr. Brechtel's office, you might get physical therapy, massage, and chiropractic, or maybe even acupuncture, plus maybe a nutritional consult. So all of those are good. And what patients really want for their pain consult is somebody taking them seriously. They want things to be explained to them. They want to understand why they're in pain. A lot of times they just need to be reassured that it's not going to get worse, they're not going to be paralyzed or disabled. And focusing on what can be done is very important in enhancing patient self-efficacy, belief in treatment, and their participation in care. So they need to perceive us as empathic and not just saying, oh, geez, they're in pain, we've got to get out of that room as quickly as possible. So these are some things that actually were found to increase patient satisfaction and a sense of autonomy in treatment of back pain. Open-ended questions, affirmation, reflective listening, empathy, and summarizing. And this isn't just in the civilian world. This medical acupuncture and other approaches for chronic pain are now entered into the military. And there's a military with not only chronic pain like traumatic brain injuries, blast injuries, and post-traumatic stress syndrome have decided that they also need a holistic, multidisciplinary model to care, including acupuncture. In fact, there are battlefield acupuncture treatments that can be taught by done by a technician in an injury on the battlefield where morphine might not be available, the patient's in transport in an airplane or helicopter. And these are points that actually can relieve patients' pain immediately. I had a patient in last week who was a nurse at UTMB and had fairly severe back pain for 3 or 4 weeks and had tried multiple things. And we put in these 4 or 5 acupuncture pins and like a little tap. And by the time we got the 3rd one in, his pain was gone. He said, that's the first time I've been out of pain in 3 weeks. So there's a number of different indications the World Health Organization gives for back pain. There's more detail in this article, which we posted for you on medical acupuncture. But even JAMA, the clinical evidence synopsis here, this is a meta-analysis. They found that acupuncture reduces pain outcomes compared to sham acupuncture, which is giving acupuncture non-acupuncture points or no acupuncture control, of up to 50% improvement for acupuncture. So back to this guy, and just wrap up here with a few more slides. This is an interesting piece because I like the concept that there's a lot of things going on in the back pain. The patient has a condition, we try to do an intervention, but how that patient responds is based to some degree on their motivation, their attitude towards their condition, whether they perceive it's going to be helpful or not, or how severe they think it is. If they think they're going to get better, they possibly will get better faster. if they've had experiences with previous treatments and they haven't worked out. So all of these things can be helpful for them to be active participants, but also their expectations and ultimately outcomes. There's actually a lot of guilt and frustration with these patients. They feel like they're guilty because they're not supporting their family, or they're frustrated with the medical care system because we haven't been able to solve their problem. So there's a lot of trust that we need to build, especially if patients have failed to have success in treatments before, and avoiding overpromising but staying with the patient, and if one thing isn't working, layering in another option. So there's a number of unanticipated benefits of these complementary therapies for back pain. And in this article, they found that patients actually had increased hope and ability to relax, awareness of their body, sense of well-being, and they were able to cope better emotionally with their treatments because something was being done and something that they participated in rather than just being a passive recipient of care. So patients who perceived themselves unable to control their back pain had a 40% increased risk of poor outcome in follow-up. Very important as patient factor. Massage can be particularly helpful, especially when combined with exercise and education. There's evidence that acupuncture massage, which is massage over specific acupuncture or trigger points, can even be more effective. So, in conclusion, the chronic pain really demands an expanded approach, and integrative methods may improve care, its delivery. And so we have to look at either, rather than either or, it's either a drug or it's surgery or it's chiropractic and acupuncture, often a combination of those may be the most powerful to optimizing patients' care. So I'm going to switch gears right now and go to a demonstration of acupuncture. It's something I do on a weekly basis in my clinic. I took training with UCLA, had a course for physician acupuncturists back in the 80s, and I've been using it in my practice ever since. So here's a few of the tools of the trade. In my exam rooms, I have massage tables because patients are laying down for half an hour or longer, and they're much more comfortable than the standard exam tables. There's a variety of sizes of needles. I'll pass some of these around. You guys can, if you want to stick yourself, that's fine, but probably not. And these are just based on the patient's body size and where you're putting the needles. Medical acupuncture often includes the use of these little electrostimulation devices.
Can I open one of these?
You can open them, and yeah, you can keep them actually. We had a patient went out to visit, or a student went out to visit a veterinarian on the west side that does animal acupuncture, and she, because acupuncture works for animals too, she was doing it for hip dysplasias and dogs and this kind of thing. And the student stuck a needle in her hand and fainted. And so she was worried because she never had lost a student before. So if you want to stick yourself, I'm not going to be responsible. Okay, so anyways, we've got the different size needles. We've got the massage table. I even use a little aromatherapy here in the room because sometimes patients are a little anxious. This is Texas lavender. Okay, those of you in the front row can, oh, I know he loves it. All right, so what I'm missing here actually is a volunteer. Okay, does anybody want to just volunteer and I can do a little acupuncture? Okay?
You go ahead. No,
Okay.
go.
Do you have back pain?
No.
Okay, we're going to give you some. Okay. No, okay. Now this is the biggest question that my students have is, can you help us for us? That does it hurt, okay? And they always worry that this is a terrible, painful thing for patients. But most of the time the patient will say, oh no, that didn't hurt. I really liked it actually, and by the time the patient's had a few treatments, they tend to just fall asleep during their therapy. We're having these videoed for your classmates that didn't make class today, so they're integrity, and they can watch the demonstrations. Okay, what's your name?
Alex.
Alex, okay, so Alex, you don't have a back pain problem, okay? You're just volunteering just because you're a good sport. Okay, so let's first of all, first thing you want to do, mind if I lift up your shirt?
Yeah.
Okay, and there was a video for you guys all to look at what we do for back exam. It's going to be somewhat less detailed here than we may do a practice or chiropractic. The first thing you look at the back, okay? Look at the curvature of the spine, curvature of the spine, stand straight, and curvature of the spine, see if there's any scars, and then you palpate for any areas of muscular tension or spasm, bony tenderness. And then you put them through a range of motion, extension, flexion, lateral, flexion, rotation, okay? You can sit them on the table. You can check reflexes. I didn't bring my reflex hammer, but I'll use my karate chop here. Okay. And then finally, you kind of lie down on the table and take, and you can do a straight leg raising. Okay, and straight leg raising can be done passively or actively. I like to let the patient do it. And this elicits radicular pain. Okay, they've got sciatica or something. A little stiff in your hamstrings here. Can you take your shoes off? Okay, so all of the acupuncture points are located anatomically, okay? And they're given names like bladder, kidney, lung, and it's based on the major meridian the major organ that those meridians cross. Meridians are kind of like, think about them as microtubules that convey essential energy. So bladder 23 in the lower back is kind of home base. It's a little bit to the outside of the interspace between L2 and L3. Chinese anatomical inch is the width of a thumb, so it's actually considered 2 thumb widths out, and you can actually feel it. So these needles that you got, they're in a little plastic tube, and they're locked on there, so you kind of unlock them. We have a little alcohol wipe here. It actually has never been proven that using alcohol to wipe the skin before acupuncture does anything. Okay, I might do it more to just make the patient feel like I'm being clean, but there's, the needles are so small. These are a 37 or 35 gauge needle. You get lots of little pinpricks and so forth through the day that are much more traumatic than this. If a patient's diabetic or has AIDS or something, I might do it. Okay, so there's a needle. Scream. Okay, do it. Okay, how did that feel?
I don't really feel anything.
Okay, so she didn't really feel that. Okay. All right, so then we'll put another one over here. Oh, got a little twitch on her that time. Okay. And that silver tray there. Okay. And typically when patients come in, I'll do a treatment. The treatment will be about a half an hour in length. Once we've got the needles set up, I might have a heat lamp. I'll walk out of the room, I'll go see another patient, and my nurse will maybe even take out the needles. Okay? How are you doing?
I'm fine.
Alex, you're a trooper here. Okay.
It's like a little stick whenever it comes in, but
So yeah, just as it goes through the skin, sometimes there's just a little stick, okay? And it's like a histamine release. We call that a needle flare reaction. So even though Alex doesn't have back pain, now the model would be that there's probably some congested energy in that back. And that she probably needs to do some stretching, some yoga, something like that to prevent her back from getting into problems later, which is good for everybody as a general rule anyways. Okay, so we put those are kind of local points, and then we have distal points, because this bladder meridian that we're treating starts here next to the eye, goes down the back and ends down here by the little toe. So acupuncture is used for other things besides pain. For example, the little toe point can be used to induce labor. You're not pregnant, are you? Stay away from that, okay. All right. And there's also there's auricular acupuncture. Now, if you look at your neighbor, and you have to kind of hallucinate this the first time, but you remember the homunculus in neuroanatomy? Okay. Imagine the ear is an inverted fetus, okay? And the head is down here, and then along here is the spine and the legs. Just look at your neighbor's ear, okay? Everybody's got kind of the same conformation. Imagine it's an inverted fetus, okay? So the back point is way up here, kind of like the lumbar point. All right, so I use that. And then there's just kind of a general energy point here. And these points are pretty easy to do. Actually, there's some schools of acupuncture that only do ear points.
I'll look in the camera.
Okay.
My mom's gonna be on TV.
All right. Okay, very good. And then there's one point right on the top of the head. It's where the posterior fontanelle is in infants. And it's called the meeting of 100 meridians, or 100 ancestors. And it's kind of just a general harmonizing point. If any of you have a needle, you can stick this in the top of your head and you'll find that it improves your ability to concentrate. When I did my acupuncture training, our teacher told us that, and I went and stuck a needle on the top of my head, walking around with it. And when I was reading, I found like I was reading a lot faster. So I don't know, I can't promise, but I was reading my acupuncture stuff for a couple hours, I thought, and I looked up and in 20 minutes it passed. So anyway, it's another application. So these little electrical stimulators came into vogue in the 50s. Even in China, they were using acupuncture during that time for analgesia during surgery. And there's some amazing pictures of people getting C-sections and craniotomies and other kinds of therapies under acupuncture analgesia. But what they traditionally did was just twist the needles. Okay, so you can imagine twisting needles for 8 hours during a surgery under some surgical sheets doesn't really work very well. So they developed these, which are basically a transcutaneous nerve stimulator, and they turn these on to a low frequency, and you get the same effect, and you can walk away. So a lot of times I'm doing a treatment for a patient in the office, I'll get this set up, I'll walk away, and then give another patient my attention, and the patient falls asleep. So what we're going to do is hit you with a little electricity now, okay? All right. It's a 9-volt battery. I hope it's not a new one. Okay. All right. So right over here, you're going to feel just a little, it might be like a little tapping, a little electrical. Feel it?
Okay, yeah.
Those of you up close might actually see it jumping a little bit. Okay. This would be in this. Is it too strong? Is it okay?
No, it's just like a really gentle tap.
Okay. Now, acupuncture is very safe. Once in a while, a patient will faint, okay? The same as like when you get a blood draw or a shot, so vasovagal faint. If you get too rambunctious up in here, potentially you could get a pneumothorax, which is never a good thing. If you stick the needle too deep, it'll pierce the pleura. Yeah, you can.
Wow.
I never actually had that happen, but I heard of one guy was given a demonstration class, and he, instead of marking the points, he stuck needles on both sides, and the patient fell backwards and punctured both lungs. So that wasn't very nice. Okay, so
Exactly.
he asked if I did acupuncture myself. I have, actually. I had a knee problem for many years, so when I come home from skiing, my knee would be sore, so I'd take a hot tub and have an adult beverage and stick some acupuncture in the stuff. I'm not telling. Okay. It was organic, though. Okay. All right, so here's the last couple. These are going to be down your leg, okay? This is going to be in your right leg. You'll feel it either behind your knee or at your ankle. Feel that?
Yeah, behind my knee.
Okay, it's too strong?
That's fine.
No, okay, okay. And then this one on this side, about the same. Okay? All right. You good? Can you feel it?
Yeah, gentle, yeah.
Yeah, good. Okay. All right, so kind of question one, the students always ask, how does it work? I mean, does it hurt? And then for how does it work, we really don't know. That article that I put in there has a number of different speculations, but there are definitely measurable impacts on endorphins, dynorphins, cytokines, inflammatory mediators. There's a kind of a gating effect. There's effect on myofascial electrical conduction. There's kind of the pattern of injury current that's set up whenever you have a little injury, so there's more circulation to the area. So anyway, so we're going to let Alex percolate here for us. Kind of like find souffle, you know, what you put in the stuff in the stove, you don't want to mess with it. And we're going to switch over. I think we're going to start next with with our chiropractic treatment. This is Dr. Mary Brechtel, and she is a good friend, and we refer and share patients often back and forth.
Hey, I'm Mary Brechtel. I'm a chiropractor here on the island. I have Health Matters over on Stewart Road. I've been in practice about 14 years. Dr. Supina already mentioned the things that we do. I'm board certified in nutrition because we like to not only get patients well on the outside, we try to get them well on the inside too. We work with our primary care doctors, and a lot of specialists refer to us as well for all kinds of conditions. The most common condition, of course, is low back pain, but we also treat lots of headaches, neck pain, knee pain, shoulder pain, wrist pain, jaw pain. Anywhere you have a joint, we do something called joint mobilization to help the joint function better. Chiropractors look at the whole picture because it all works together. It's like the old saying, the knee bone's connected to the shin bone, and it's all true. So we look at the whole body to see how everything is functioning. So just because someone comes in with low back pain, we also look in other areas of the spine or other parts of the body to see where that might be actually originating from. I have a student with me today. This is Joanne. She's getting ready to graduate. So we're going to do a diversified adjustment on her so you can see what that is all about. But I also do other forms of adjustments in my office too. We use something called Activator, and I forgot to bring it. It looks like a little gun, and it just gives a little click and slightly moves the vertebrae over. So it's a really gentle way to mobilize a joint. You don't hear the popping with it. You may not have all the endorphin and enkephalin release that you do with the diversified adjustment where you hear the noise, but it's very effective. And we use that tool for patients with osteoporosis. My oldest patient is 102. So chiropractic is safe for all ages. My youngest patient was 8 hours old. So it's a large range of patients. So we use the instrument a lot on where we need to really be conservative.
Can I just make a comment?
Sure.
My dad was visiting from Phoenix, and his back would go out from time to time. And he was 87 or 88 at the time. And he went to Mary's treatment. They used this actuator, which was invented to knock teeth out. Some engineer, but she can control the spring loading. And he'd had back problems all his life. And typically when his back went out, he'd be down for about a week. And he'd go get a chiropractic and all that, but he'd still be really out of it. And so she used that very gentle little physical therapy. And the next morning he got up. I can't believe it. I'm just like, you know. So that device, I think, was much more effective for somebody who's in their 80s than
Right.
more aggressive.
Right, so especially for our elderly population and our really young population, we always use instrument adjusting. There's no twisting of the spine or the neck or anything like that. In our younger, healthier population, they usually do prefer diversified adjustments where you sometimes hear the popping. Okay, so that popping noise that you hear, all that is gas that crosses the joint when we adjust you. It's not bone crunching or anything like that. So that's what that noise is. Lots of studies on what that is. It also releases endorphins and enkephalin. So usually people that get adjusted usually have immediate pain relief. They feel pretty good and they walk out of their doctor's office, almost pain-free in some cases. And then any other, do I need to repeat the activator, or you've all kind of got that instrument? Okay, good. So we use that for kids. And then we also see a lot of pregnant patients in our practice, and we use a technique called sacro-occipital technique, which is a real gentle mobilization manual massage type technique that works very well for those patients. Okay, so what I'm going to do is I'm going to demonstrate with Joanne, our student, a chiropractic adjustment. I'm first going to adjust her thoracic area, and what I'm doing when I'm adjusting is I'm palpating different areas. You can go ahead and lay down. And I'm looking for joint restriction, because that's really what an adjustment is, or a manipulation, is just an area that we're changing the restrictive joint and making it mobile again. So usually I'll just go through and just palpate. And once you're a chiropractor and you've been doing this a while, you just feel everything. Just like massage therapists, or Jeremy probably feels everything. Dr. Serpinas probably feels a lot too with acupuncture. So she's really restricted in her upper thoracic area, and sometimes when you're palpating that area, the patient will say it hurts. So that's one way to know that the joint is restricted. So what I want you to learn from this is make sure that you all palpate your patients. Don't be afraid to touch them. Okay, and she's a little restricted in her upper thoracic, so I'm just going to do a gentle manipulation there. Okay, take a deep breath. Blow it all the way out, nice and relaxed, and good. Yeah, and she did really well. I don't know if you could hear it, but there was a cavitation. Okay, and then I usually palpate the upper thoracics. Just going to feel a little adjustment there. Good. Perfect. Okay, let's have you turn on your back. Okay, now we're going to adjust her cervical spine. I usually always use lateral flexion. We're really careful about rotation. Okay. Stretch. Good. And even though it sounds like it might hurt, does it hurt to get adjusted?
No.
No, it feels, if you've ever popped your knuckle, it's kind of that same feeling. You know, that doesn't hurt. Yeah, it doesn't hurt. Okay, now I'm going to adjust her on her side. I'm going to adjust her sacroiliac joint. So let's have you turn and face me on this side. And if we had more time, I'd go through and show you how we examine and determine which side to adjust first and exactly how to adjust that joint properly. Is this comfortable for your head? You okay?
Yeah, fine.
All right. And this table's a little tall, but that's okay. I'm gonna have you let go. There you go. And I'm just gonna kind of stretch it out here. I'm gonna have her relax that muscle there. And good. There it went. Okay, and let's go the other way. That was the table.
I've had some really big male patients that are amazed that little Mary can just pop their backs.
Yeah.
Technique.
It's all about the angles. That's why physics was so important in undergrad, because you're going to need it in chiropractic college. Okay, feel a little stretch. Relax that muscle there, and good. Good, there we go. Oops, losing my microphone here. All right, she did very well there. Okay, let's have you lay on your back. And then I always measure again. I'll check their leg length and make sure that they evened out again. And she did. She's completely even. So we always check leg length. We check SI joint flexibility. We'll have them laying on their stomach, measuring how far their heels can go towards their buttocks and see with their pelvis and how they're balancing. Chiropractic care is a great conservative treatment to recommend for your patients first before you do drugs or surgery. So that's one reason that you would want to use chiropractic care, or acupuncture or massage. You know, always try the most conservative thing first with your patients. Any questions? Yes.
So does the patient have to be really relaxed? 'Cause I know sometimes they're a little scared and they may not be able to fully relax. Does that prevent you from doing your job?
I would say yes. That's why in our clinic we do a lot of therapies first. So we usually have them do muscle stim, kind of what she has on her back, but we have it using pads, you know, the stimulation unit, and then we have hot clay packs. And then every patient at our clinic usually has some type of soft tissue work before their adjustment, and that makes a huge difference. But I don't always need to. Some people are really easy to adjust, others are really difficult. So we do use a lot of, once we get the patients out of acute pain, we do go right into rehab therapy. We do have a physical therapist on staff at our clinic, but all of our assistants are trained in rehab therapy too. So we try to make it where once we get them out of pain, we work on doing a lot of exercises and things to keep them out of pain.
Mary, can you mention a little bit more about leg length discrepancy? This is something I learned over the years from chiropractors, and I started measuring patients' length. Sometimes it's a anatomical leg length discrepancy that they're born with, and sometimes just a little heel lift can help. Or sometimes it's a functional one because their pelvis is tilted, and they're kind of like, it's shortened because of muscle spasm and shortening rather than physical.
That's exactly true. So usually what I do is I always have a bolster underneath. We don't have one today, and it's really easy to measure it. The most important thing when you're doing your leg length check is to do that foot flare. Because, you know, we don't usually walk around with our feet like this, right? We're usually like this. So that's how we measure. And, you know, she's even now because I just adjusted her. And then the other check I usually do is, this just tells me which way the tailbone or the SI joint is tilting. I'll bring their legs up like this. As long as they don't have knee problems, you can check it this way too. And for her, well, she's pretty even because I just adjusted her. But most people will be, one leg won't go as far as the other. You'll feel the resistance, and that kind of tells you which way the tailbone is shifting. So that's one thing we always check. So that's one way you can see if your patients are out of alignment and to see if they need an adjustment. And like Dr. Supina says, sometimes it's a functional problem with their leg length. Sometimes it's a structural problem. So it takes a little while to ferret out exactly where that's coming from. And sometimes we do use heel lifts. We do custom orthotics. You know, some people need support for their feet because that's the foundation for the rest of their bodies.
So one way that I do is I measure from the anterior superior iliac spine to the lateral malleolus. And anything under half an inch is probably not very significant, but anything over that definitely is. And so sometimes the orthotics can really...
Yeah, they make a big difference. I always tell patients when their leg length is really far off that it's like you're a car driving around with 20 pounds of air on this side and 10 on this side, and you're driving around and the tires wear uneven at that point. Well, the same thing happens in your body. The joints wear out faster on one side than the other. you have a question? Okay, there's always a risk of stroke, but it's about 1 in 5 million. New studies indicate that you're just as likely to have the stroke going into your primary care's office as you are coming into our office. Our malpractice insurance is about $1,800 a year. So if we were hurting patients, wouldn't our malpractice insurance be really high? So chiropractic is relatively safe.
Mine's 12,000.
Yeah. 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 So chiropractic is pretty safe, you can tell by our and that's a good question to always ask is, what is your malpractice insurance running? And you'll know how safe that profession is. So.
Okay. It's not bad. I mean, it probably looks scarier than it feels, but yeah, it's kind of relaxing, and I mean, laying down on a cushy bed is nice. And we're just missing the music. You need like some Zen music.
We do have that in my office. So why don't you stand up and see how you feel? How do you feel? Yeah, kind of move your back a little bit. All right. But keep in mind, she didn't have anything wrong before, so I'm glad you
Yeah, exactly.
Thank you very much, Alex. Let's give Alex a great hand.
Okay. Well, my name is Jeremy Gustin. I'm a massage therapist over at the Field House right across campus. And I've been practicing for about 13 years, and I specialize in myofascial release therapy. Most of the clients and patients that I see come in with back pain or headaches or some type of dysfunction where they're in pain. The first thing you want to do whenever talking with them is make sure they're hydrated. Whenever they want to be drinking copious amounts of water, so I usually refer them to take their body weight, divide it by 2, and that's how many ounces of water they should be drinking a day. And you usually find most people do not consume enough water. Whenever there's restrictions in the myofascial system, the tissue becomes binded down, and you could feel the hardening of the tissues. Whenever the hydration levels are picked up and they start drinking more water, it's a lot easier to do the treatments on them. Now, Joanne here, I'm just kind of palpating around. I'm doing almost like a shiatsu style, which is acupressure on her, that you could do above clothing. And you could start feeling she has a little bit of restrictions in her lower lumbar area up through her thoracic. And with myofascial release, you're wanting to introduce opposing cross hand stretches into the tissue. And so you would stay into the tissue applying pressure for about 30 seconds until you could feel it's almost like a taffy stretching type feel. It's after about 30 seconds of engaging the tissue, you want to hold that stretch for about 90 seconds. And after about that 90 seconds time, after you hold that, you'll be able to feel a softening of the tissue. Most of the time, I probably see a lot of people who come through the acupuncture come to have the body work, and then they'll go do chiropractic. So you're wanting to increase circulation to the area before you're doing more aggressive techniques. I'm used to working skin on skin, so we're trying to make her taller. We're definitely introducing a little stretching into her lower spine with the leg pulls. And like Dr. Brechtel was talking about, the hip, you usually will have an anterior rotation and one will have a posterior rotation. So it will give you a long leg, short leg type symptoms causing dysfunction in the lower back. So with Joanne, she has been chiropractic. She is aligned right now, which is a good thing. Hydration of the tissues is what we're working with. Just palpating until you actually get a vascular response where you would actually see blood flowing into the area. You'll see the redness of the skin changing. I use not a lot of oil whenever I'm doing my massage, because you want to use the skin actually as a handle. So you're doing the different cross hand techniques and palpating, introducing fresh blood into the area so it can, the body can do its own healing. But if anyone has any questions about massage,
that I wanted to make about both massage, especially the myofascial and chiropractic, is that people with chronic pain develop maladaptive gait and positions and movement. Okay, so that because of pain, they don't move normally, and so they develop constrictions that aren't normally there. So part of our work with acupuncture is helping people relieve pain, but chiropractic and myofascial often helps them to kind of get back to rebalancing what's a normal movement. Okay, once they're out of pain, they can go back into that pain center where they keep kind of walking strange because of their hip rotation or whatever. So it's an important part of all of these therapies to have people kind of return as far as possible to kind of a more normalized movement pattern.
I'd say probably about 75% of the people I do see with lower back pain come in and they've had some type of surgery, whether it be steroid injection or some type, you'll end up usually having a compression on one side of the spine, causing the disc to actually bulge on the opposite side. And through time, that side ends up becoming damaged through just being not integrated. Both sides would be out of alignment. Myofascial release, actually was started with the type I learned was John Barnes myofascial release. It is introduction of sustained pressure into the myofascial system, which is the connective tissue that runs from your head to your toe. If you can see a cell in a picture, the outside cell connected to the next cell is all connective tissue. So it's sustained pressure introduced into the system that helps increase hydration into the connective tissue. So it's a lengthening. Instead, with massage therapy, you're dealing a lot with palpation and just increasing circulation, relaxation. This is dealing with more tension that's brought up from acute injury through trauma, whether it be accidents or through surgery. You get scar tissue, stress. Second-year med students, they've had 4 years of college and 2 more years of med school, so y'all been in the books a lot. So a lot of the people I see who are med students are going to have thoracic issues and cervical issues. Usually, a lot of the people I see do a lot of running. So the lower back pain is from constant footfall, just constant low back pain.
So to follow up on Mary's question, there are, like with acupuncture, there's probably 60 different kinds of acupuncture styles. There are many, many different kinds of massage techniques. There's sports massage, there's shiatsu. There's deep muscle massage. There's just kind of relaxing spa massage. It's always very nice. There's stone massage and various techniques over lots of different cultures. The Orient is replete with massage techniques from Japan and China and Indochina and India. So you kind of have to figure when you go for massage, it's usually not covered by insurance. You've got to kind of like figure what it is that you want out of it. If you just want to go and get relaxation at the hotel spa, that's great, feels good, and you'll feel good. But if you have a significant health problem, you don't want to just feel better for a while. You know, you want it to kind of repair itself to the best you can. And so that's why all professional sports teams now have massage therapists to help people stretch out their muscles and reduce inflammation, injury, and there's a wide variety of techniques.
Yes. Now, with the practice that I do, a lot of times we'll see people for their first sessions and we'll see them once a week. So about once a week we'll see them, and gradually through time, it's an exponential process. We'll go to every 2 weeks, and then usually you'll find a plateau where the patient finds, okay, my symptoms are coming back. Usually the bulk of my patient load comes about once a month, just for a tune-up.
Yeah, for acupuncture, it's very similar. Initially, for a chronic problem, we'll see them weekly, and then standard initial dose is 4 to 6 treatments. If they haven't had any response after that, we're probably not going to continue, but usually they do. And then we start spacing them out to every 2 weeks or 4 weeks. How about you, Mary? What's your usual time course in terms of chiropractic?
Mine is very similar to physical therapy because we do a lot of rehab therapy in our practice. So usually if you're seeing the physical therapist 2 to 3 times a week, you'll see a chiropractor for 2 to 3 times a week for about 3 to 4 weeks. After that time, we do a re-exam and reassess and make sure that everything is improving as it should. If they're not a lot better, then we refer out. Otherwise, we also, at that time, reduce the amount of time that we see them, and they're really into active therapy at that time. There's not as many passive therapies.
Another thing, most of my clientele that I do come across, they're looking for alternatives without the pain medicine. Most of them are active participants in their healing process, so they're seeking out acupuncture, body work, and chiropractic. Anything they can do without having to go through surgery for rehabilitation.
I'm going to pass out Mary's goodies over here.
Are you all noticing any kind of shift where insurance is more likely to cover this kind of stuff?
With myofascial therapy, especially like with Dr. Brechtel, she sees a lot of insurance patients.
And most insurance is covering chiropractic care, and in my office they cover massage that's under my license. So that's how it's working right now.
I can do insurance billing with the doctor's prescription, but just through history of the process of doing insurance billing, it's very labor intensive.
Yes, it's not
So
worth it.
it's
Not worth it, yeah.
I would have to hire a full-time person just to do my insurance
And
billing.
acupuncture is about 40% of people have insurance that cover it. They may use their flex plan from their place of employment, but mostly it's out of pocket. Acupuncture and massage are about the same. I think we charge about $90 at UTMB for acupuncture treatment, and massage usually 100 or something like that for an hour or so.
It's like about 75
Yes.
right now. So,
All right. Any final burning questions? Thank you all for your attention.
great.
UTMB Health, working together to work wonders.